Hello.
Hi.
You remember me from last time, Jill?
Yep.
Yeah.
Yeah.
I saw you about a couple of weeks ago.
Yeah, I remember.
Yeah.
Yeah.
And you referred yourself to us.
I did, yeah.
With a low mood
Yes, I did,
that
yeah.
time.
Yeah.
At that time, we got some things checked out for you. We got some.
Yeah, I went to the hospital and got some bloods, like you told me to.
Done,
yeah.
And you've had your blood pressure checked.
I did, yeah. I think they were all okay, weren't they?
Yeah, they were all okay. You've had an ECG as well, haven't you?
Yeah, I had that done as well, yeah.
Right. And you did a PHQ, that test where you have to tick off how you felt in the last 2 weeks.
Yeah, I did that, yeah.
And that was quite a high score for you.
Right, okay.
Well, it was showed quite a severe depression.
Right.
Does that reflect on how you've been feeling?
Yeah, I think so. I mean, I'd certainly say I've been feeling really, really low. I don't want to get out of bed in the morning, don't really want to speak to people, don't want to see people.
Yeah.
I'd rather just stay in the house and not really have to talk to people. I mean, it's been a struggle to get here today, but I knew it was important, and I don't want to be like this.
Yeah, I'm sorry about that. But we're here to try and support you.
Yeah.
There's just a few things I need to ask you, because obviously it was a brief time that I saw you last time, and I just need a bit more history from you, if that's okay.
Yeah.
Can you just clarify your date of birth?
Yeah, 27th of the 9th, 80.
Okay. And are you feeling quite well at the minute physically?
Yeah, no, I don't really like going to the doctors, to be honest, but I've never really had any problems or anything before, apart from this mood.
Right. Okay. So you've not had any operations?
No, I've never been to the hospital.
Never been to the hospital.
No.
Have you been abroad recently?
No, I can't afford, and to be honest, like I said, I don't really want to come out of the house.
Okay. Can I ask you about your family?
Yeah, I mean, I've got quite a good relationship with my parents, but they do live about an hour away, so I don't see them as often as I should do, really. But I do speak to my mum quite a lot on the phone.
Okay, that's good. And they keep well, do they?
Yeah. There's no problems with my mum and dad.
Okay. And are you married?
No, I'm on my own at the moment. I did have a recent breakup, but no, I'm just on my own. It's better off that way.
Do you think that's maybe why?
Yeah, I mean, it was a tricky time, and I did, I thought I dealt with it, but maybe in hindsight, maybe that kick-started everything off, and I think I need to sit down and look at, what happened, really.
Okay. Have you got any hobbies?
I potter about in the garden, because it's in the safety of my home, but not really anything else. I don't like going out.
Okay. Do you smoke?
No, I don't smoke.
Any alcohol?
No, I just stay off it all, because when I drink I get more and more depressed, so no.
And do you take any over-the-counter medication?
No, nothing.
Any other people's medication?
No, I don't really see people, so no.
And do you have any allergies that we know of?
No, not that I'm aware of, no.
Not had any adverse reaction to any drugs?
No reactions, no.
Okay, so you're feeling quite well physically at the minute?
Yeah, apart from just physically I feel fine. It's just my mood, and I feel like I can't snap out of it.
We talked about your difficulty sleeping last time.
Yeah, I mean,
and that's a big problem, isn't it?
It is, and I think that's part of the problem. I think, I go to bed, I lie there, I have thoughts going through my mind, I finally drop off at 3 o'clock in the morning, and then I'm wide awake at 5 o'clock, and then that cycle just continues. And then
you're probably tired the next day.
And I just want to sleep. I just want to go to sleep.
Okay. we discussed some options last time, and I gave you some information to take away.
Yeah.
And have you any thoughts on? There was 3 different kinds of medication that we thought about.
Yeah, I did sit and look at it. I mean, it took me a couple of days to actually think about it.
Yeah.
I didn't like the look of 2 of them. There were things on it, the side effects that just didn't like. I think the one that stood out for me was mirtazapine,
yeah.
because I think it said it helped with sleep and also appetite.
Yeah.
Because I haven't got a good appetite at the moment.
Yeah, you've lost a lot of weight showing from your records. We can do with keeping an eye on that weight.
Yeah, I agree with you on that one. I mean, I just, like I said, I can't be bothered going out. So I don't buy any food and then I don't eat, and it's like a vicious circle.
And that's not going to make you feel well.
No.
Nutrition is a big part.
Yeah.
So we can consider that option.
Yes, please.
We would start you on 15 milligrams, which is the lowest prescribed dose.
Okay.
That is good. It's good for sleep. That dose.
And is there a maximum that can be increased up to?
Well, we can. We won't think that far ahead. We'll start you on the 15, and then the therapeutic dose is the 30 milligrams.
Okay.
But we'll see how you go. Monitor you for any side effects.
Okay.
And I'd rather have you back in 2 weeks' time.
Okay.
Just to keep an eye on your mood and any side effects of the medication. See how you're getting on. If you've appetite's increased, if your sleep's increased, and then we'll take it from there.
Okay.
Have you got anything you'd like to ask me?
Is it just medication that can help with my mood?
I was just going to say, suggest some psychological therapies we discussed last time.
Yeah, I mean, that was something that when we discussed it last time,
you were keen on.
I'm quite keen. I mean, don't get me wrong, I am really anxious about it, and it's not something that I want to put myself into, but I do feel that I need somebody to talk to.
Yeah, you need something, yeah. What I'll do is I'll refer you to our IAP service, which is the psychological therapist, and we'll get somebody to come out and see you, and we'll do the IAP assessment. They'll just need to see which areas that you need help with. Okay.
Yeah.
I think that's about it just now, and I think I'll just write you a prescription for that.
Yes.
For 2 weeks. 2 weeks supply. And I'll see you again in 2 weeks' time. Is that all right?
Thank you. Yes, thank you.